You got to take his.
All right, we're getting ready to go hot.
Welcome to Straight No Chaser. So grab a glass and join your hosts, your girl Ann BZ, Pastor C, Thin Bad, and the Chief.
All right, we're about to go live. I can hear your background.
Okay, I'm getting ready to turn it on.
Welcome to Straight No Chaser, where we never dilute the issues, we only serve the hard stuff. It's the Chief, and I'll be holding it down this evening until Thin Bad joins us a little later on. But tonight, ladies and gentlemen, we're talking the coronavirus. It's here, and it's here with a vengeance, unfortunately. It's sickening people, and unfortunately, it's even killing a few people. And that's something that none of us want to hear and none of us want to have to talk about. But across America, schools, businesses, churches, parks, and whatever else you can think of that's not essential has been closed down. Governors and mayors across the country have issued directives to increase social distance, keeping people home, and closing schools and other types of facilities that people are used to attending and taking advantage of every day. And as you would expect, people are worried. They're confused, they're depressed, and pretty much they're generally in a daze, just trying to figure out what's next, what's going on. Governors and mayors are aggressively seeking assistance for the states, and Congress recently approved a bill to assist employee and employers that may have been impacted by this coronavirus pandemic. However, the focus still remains on healing, prevention, and most importantly, stopping the spread of this horrible pandemic. So to help us figure it out is a good friend of our show, and he's back again, ladies and gentlemen, Dr. Eugene Albright from Riverside, California. And Dr. Albright is in the studio with us tonight. And Dr. Albright, welcome to the show.
Thank you, Mike. Always a pleasure to join you.
Thank you, sir. Now, Dr. Albright, kind of give us an update on what this coronavirus thing is doing right now. Just kind of bring us up to speed, and then we'll get into some more information.
Okay, well, as anybody who's following what this virus is doing, you know.
Yes, sir.
If anybody who's following the virus, you know that at this point in our country, New York City is the epicenter, which means it's the location in our country that has the most infections and the most deaths. Washington State, where this virus first hit, is second, and California is third. We've just, in the last day or two, been notified that New Orleans, who just hosted the Mardi Gras, is now the fastest growing infection and death rates recorded in the country. And this afternoon, the mayor of Atlanta came on the air and told us that they're starting to have outbreaks in Atlanta, and Atlanta's health system is already almost at capacity. So again, they are all calling for assistance in dollars and equipment, PPEs and everything from the government. That's kind of what's happening now worldwide. Spain is now approaching Italy's numbers, and Spain has the fastest growing infection rates of the other countries in the world. But there's been recent outbreaks in England. You know, Prince Charles has the coronavirus. And so this thing is actually what it says, a pandemic, means that it is sweeping the whole world. That's probably the latest update I could give you right now.
Wow. And before we go further, I want to remind our audience to please feel free to chat with us. We want to certainly hear from you. And also you can give us a call at 240-508-8095, 240-508-8095, and we will get you and your comments on the air. Dr. Albright, just in terms, let me go back to what you were talking about from the Mardi Gras in New Orleans. Can we assume that some of the participants from the Mardi Gras who are now going back home to Texas and Chicago and Alaska and so forth, they may be possibly taking the coronavirus to their homes?
That's absolutely correct. And that's why the experts keep calling on the president to test everybody or to do widespread testing. And the president insists that it's not necessary because in a lot of areas of the country, there haven't been large outbreaks yet. But with something like the Mardi Gras, where you have people coming in to a small condensed area from all over the world, and now you got a spike in infections occurring in New Orleans, you know that many of the visitors leaving New Orleans are going to take that virus back to places that didn't have viruses or had only small amounts of people who were infected before. So it's just a nidus to extend this virus to everywhere. And still in this country, we have no idea what the real infection rate is because we're not testing. And no matter how many times or how many people keep emphasizing to the president how important it is to get people tested, he doesn't see it. So this could be and that's, I'm sure, what sparked Atlanta's rise in infection, because many people from the South converge on New Orleans and then go back home. And now I think we're going to see as well down in Birmingham, Alabama, they've had outbreaks. So I think we're seeing a seeding of the South from Mardi Gras. And that's probably what's explaining why the South really wasn't hit hard initially. But now you see all these outbreaks starting to happen throughout the South. And you know, Florida's had its share of problems already.
Wow. So let's work backwards. How can John Q. Citizen and Jane Q. Citizen protect themselves from this pandemic? Let's start there.
Okay. Well, as many of the experts have been saying over and over, the virus itself is fairly fragile, and good personal hygiene, washing your hands, making sure you try to keep your hands out of your mouth and eyes and mucous membranes, nose. That's one thing. The second thing is to stay away from people who may be carrying the virus, because if you can keep the virus from infecting you for, probably a 14-day period, we don't know really. I read things every day to tell you how long the virus can live on this surface versus that. But that's wholly inaccurate, and it's all a guesstimation. But we do know that if you can prevent yourself from getting the virus, then the viruses are seasonal, and as it gets warmer, the virus is naturally gonna, slow down and be not as infected. So the people who are telling you to self-quarantine and just stay out of the way of other people, keep people, sneezing and coughing off you, that's probably the best thing you can do to protect yourself at this particular time.
So again, how does it get transmitted from person to person?
Okay, it gets, and that's another good thing for us. The virus can only be transmitted basically if someone sneezes on you, or if you have your hands or something on your body and you put your hands into your mouth or your nose or your eyes, something like that. It has to be transmitted right from the surface to you. You have to almost ingest it. So that's why staying out of the way and staying away from people is the way to not infect yourself. Sure. And if you keep your hands clean, and the surfaces around you clean. My wife has wipes all over the house, and
Sure.
every time somebody touches something or we get a package from UPS, he's spraying it down.
That's
and
right.
all that. So to try to minimize us getting infected with the virus. And if we can do that, then that's probably the safest thing you can do for you and your family.
And I want to go back to your point about people-to-people contact. So, for example, because one of the things that we've been hearing as we're talking to our friends on FaceTime and other places is a concern. For example, if I sent my daughter to the store to pick up some milk, and she's maintaining that 6-foot distance, but she just happens to walk past somebody in the bread aisle. They don't cough. They don't do any of that stuff. Is that a situation where you could contract this pandemic thing?
No. If the person doesn't cough or sneeze on her, she just passing them in the aisle, she is totally safe. And that's the point we're trying to make. It has to be contact. And when you're in a crowded bar, people are sneezing and touching, there's countless points of contact there. But if you're in your home, away from that, then the chances of you contracting the virus, especially from an outside source, and you have to get it from an outside source, is very minimal. And that's the basis for these current guidelines. But no, just like if you're with someone and either one of you has the virus, you're not going to translate it to each other. That's a safe thing. So you don't have to be afraid of your wife or your husband. If both of you are practicing good hands and you're not going out into an environment where the virus is,
sure,
you're safe.
Okay.
But that's whole emphasis on the self-quarantine.
Gotcha. And so and as always, with these types of situations, there's always information that gets started somewhere. I have no idea, but it gets started somewhere. And of course, today there was a tweet or an Instagram message or a Facebook message that had been going around like wildfire that was warning people against using Advil or NSAIDs. According to this memo that went out, and with this information that's been going around Instagram and Facebook today, it was saying that particularly Advil exacerbates the virus, and it has caused several people in their 40s and 50s to now be on ventilators because it agitates the condition. And it says to take a paracetamol only. So can you kind of explain to us, is that fact or fiction, and what is a paracetamol? I may have mispronounced that too, Doctor.
Yeah, this whole thing about these kinds of rumors getting around, you haven't heard Dr. Fauci or anybody else on any of the medical experts come on television and say something as common as ibuprofen or Advil, which is the same thing, is dangerous to you. This is somebody, and I would ask you, and what we do is when we hear comments like this, we always ask who wrote that or who put that down, and it'll be, Coco's mama or somebody's husband or, some.
Right.
I mean, it happens all the time, and even the president is trying to get anti-malarial medicine to give to coronavirus. I mean, there's no basis, and he's been told by Dr. Fauci and others that there's no scientific basis to do that. But the president, because he's the president, is doing it anyway. And there's a couple of reports from New York that says that it may have killed some people. But, that's why it's so important. If you're going to take something for the gospel, you need to know what the source of that information is. And if it's anecdotal, which means, like, from what I understand, this comes from somebody who may have worked at a hospital and heard that the patients who died from coronavirus, when they did the autopsy, they found ibuprofen or Advil in their system, which if somebody has fever and chills and a cold, what are they going to take first of all? Advil and